I'm Chris Norton. I'm Professor of Nursing at King's College London and a nurse consultant at St Mark's Hospital. Fecal incontinence or bowel incontinence is surprisingly common. It affects about 1 adult in every 100 in this country. People get really embarrassed by it because they don't like to talk about it. People come to me with two main symptoms, either urgency, having to run to the toilet and not making it there in time, or just a passive sort of leakage from the bowel. There are many different causes and types of bowel incontinence. Probably the most common single cause is childbirth in women, where the birth of the baby causes stretching of the muscles, all the muscles down below really, and you can get bladder problems, but you can also get bowel problems, which is far less often talked about or recognised. Other possible causes, some people I see have just got diarrhoea from any cause, problems like irritable bowel syndrome. Other people have had damage to the muscles around the back passage. Others might have a nerve condition or other medical problem that's causing it. Sometimes it's drugs or diet that needs adjusting, but there are many different causes, and the main thing is to try and find what's going wrong for each individual, and then you can start to treat it. Nearly everyone we see can be improved. Most people can be cured completely. Now, obviously we can't guarantee that, but for most people significant improvement, if not cure, is available. Treatment depends on cause. Sometimes we need to do some further tests, sometimes we need to have a look inside the bowel to make sure there's no disease or inflammation going on, but usually the causes are quite easily decided and then we can start to treat it. If it's weak muscles around the back passage, then we do some exercises to strengthen the muscles there. Often we'll do a programme of bowel retraining to get the bowel into a regular habit and enable you to hold on. But we'll also look at diet, what you're drinking, what you're eating, any medicines you might need to help slow the bowel down or speed it up and get it emptying better. If those simple treatments don't work, then sometimes more sophisticated treatments involving computer retraining for your bowel, or even in rare cases an operation, but that isn't common. I think once you pluck up courage to seek help, often you're surprised by how quickly things can get better. Obviously, losing control of your bowels is a socially devastating problem, and once it's happened once, you lose your self-confidence. The more you worry, the worse it gets, the more you worry, and you get into a real vicious circle. And I think just talking to someone who's seen it before, who's going to give you some good, sensible advice about it, can break that circle, and it's the real first step in getting some help.